My name is David Weiss. I'm an associate professor in the Department of Health Professions and Family Studies. Well, clearly the healthcare concern has been raised to perhaps the most contentious social issue in recent years. Other than the abortion question, I think it now has occupied a place on par with the abortion issues, such as why we need it, how we're going about coming about making the changes, how, in what directions we should go. I mean, just reading the newspapers and seeing the television reactions, the town hall meetings show you how passionate people are about the issue. And if they're not passionate sincerely, at least enough of political controversies involving the whole issue of healthcare reform, as well as health insurance reform. Very different issues and very different directions that can be addressed in each of those areas. Well, the interesting thing about the electronic area, it being introduced into the healthcare field, a number of things. First of all, that's one area everybody agrees on. There are not many things that people agree on in terms of social changes. That's one area that we all agree on. Yes, we should be going digital. Interesting enough, the United States is most probably the least electronically involved in the healthcare field of any industrialized nations. European countries have had electronic data, electronic records for years. In many European countries, you have the equivalent of a credit card size data bank in which you go into a physician's office or a hospital. They just put your card into a computer and they'll be able to realize when you had your last visit, when you had your last surgery, what types of medications you've been on. Here, as I'm sure many individuals would know, every time they go to a doctor, the first thing you do is you're given a clipboard with a sheet, and they say, can you please fill this out? And now you have to remember, gee, did I have that hernia surgery a year and a half ago, or was it 2 years ago, or am I on 15 milligrams? These are all the things, and consequently, there's tremendous numbers of mistakes in our healthcare system as a result of the information that the electronic use of data and records will certainly help eliminate the incidence of mistakes and consequently a number of deaths. Some of the research we see is projected up to 98,000 deaths a year in hospitals, fatalities, as a result of mistakes, misinformation, et cetera. Will there be jobs opening up? Yes, very clearly. There'll be jobs opening up, by the way, in the health field. Students ask me this all the time. Is this a good field to go into? And really trying to give a novel answer to it, I could easily say, oh, yes, it's a very good field to go into. I start off by saying, no, it's not really a good field to go into unless you think one of the following is going to continue to happen. If you don't think people are going to continue to be born, continue to get old, continue to get sick, and continue to die, I don't think there's any future in the field. If you think any one of those is going to continue to happen, yeah, I think there's a pretty good field and pretty good opportunities. And clearly, the answer is yes, it's a great field in terms of job security. My first message to my students the first day of class is that folks realize you've got job security. People are going to continue to get sick. They're going to continue to get old. They're going to continue to die. They're going to continue to be born. In other words, they're going to continue needing the health services. And our job really is to figure out how to do it best. When you consider talking about doing it best, I have to tell you, to simplify the whole field, there are only 4 pillars and 4 major concerns in the whole field, namely questions about cost, questions about access, questions about quality. That's it. And there's a 4th pillar that we don't talk about as much, but you do hear discussions of it, and that's the concern for ethical concerns. So there's a whole news. I gave away my whole program in 15 seconds. Cost, access, quality, and ethical considerations. And these are the issues that are the 4 pillars in which the entire discussion on healthcare, health reform, health organization, health reorganization revolves around.